Hi everyone, welcome back. My name is Natalie and I'm a licensed clinical social worker. Today we're talking about a topic that is often misunderstood: high functioning anxiety and depression. You may have heard the term before, but it's important to really dive into what it means and how it can affect people, especially those who appear to be thriving outwardly yet are struggling internally. In this video, I'm going to share how high-functioning anxiety and depression can show up in someone's life, how people can be incredibly successful while still struggling with these conditions, and what's happening behind the scenes that often goes unnoticed. So, what is high-functioning anxiety and depression? Let's start by breaking down what these things mean. High-functioning anxiety doesn't mean someone is anxiety-free. In fact, it means that a person may appear calm, collected, and even successful, but inside they are battling constantly with worry, tension, or racing thoughts. On the outside, it may look like they're managing everything perfectly, but underneath, they might be constantly stressed and overwhelmed. High functioning depression works similarly. A person with high functioning depression may appear fine, they may go to work, handle their responsibilities, and even maintain social lives. However, inside they might feel disconnected, empty, and struggle with persistent low mood or a sense of hopelessness. It's like going through the emotions while feeling exhausted or numb. These conditions are often harder to spot because the person seems capable, but it can lead to burnout, emotional fatigue, and more difficulty in the long run. So, what does high functioning anxiety and depression actually look like? Here are some common traits. Number one is overachievement and perfectionism. Many people with high functioning anxiety or depression feel the need to constantly prove themselves. They might overwork, overperform, or push themselves to the brink, all to feel a sense of validation or control. But this perfectionism can be exhausting and often masks underlying feelings of inadequacy or self-doubt. Number two is constant worry or exhaustion. Someone with high functioning anxiety may never stop worrying. They might constantly be thinking about the what ifs or planning for every possible outcome. In the case of high functioning depression, the person may feel constantly fatigued, even though they continue to push through their day-to-day responsibilities. Number three is people pleasing and fear of disappointment. People with high functioning anxiety and depression often feel the need to please others or keep up appearances. They may feel afraid of disappointing people, so they say yes to everything, even when they're feeling overwhelmed. This can result in burnout and a sense of resentment. Number four is struggling to show emotions. Despite what's going on internally, someone with high functioning anxiety or depression may have trouble expressing their emotions or asking for help. They might feel like they need to maintain an image of being strong or composed, and this can lead to a sense of isolation and difficulty connecting with others. Number five is adapting by creating accommodations. This is one that, as a clinician and as a therapist, I really do want to highlight. This is something that often goes unnoticed. High functioning individuals with anxiety or depression often develop their own coping mechanisms and accommodations. This might include creating a very structured routine, having escape plans, or limiting social interactions to avoid emotional overwhelm. These adaptations are how they survive day to day while managing their inner turmoil and still being successful. Although high functioning individuals often seem to be managing, the emotional cost of constantly suppressing anxiety or depression can be significant. And here's how. Burnout. Over time, constantly pushing through exhaustion or emotional numbness can lead to physical and emotional burnout. The body and mind can only handle so much before they break down. Difficulty maintaining relationships. While they may appear fine, they may struggle to truly connect emotionally with loved ones, leaving them feeling isolated or misunderstood. Imposter syndrome. Despite all their success, high-functioning individuals often feel like they're frauds or that they are unworthy of their accomplishments. They constantly fear that people will discover them, that they're not as competent or together as they appear. And emotional numbness. People with high-functioning depression might suppress their true feelings, which leads to a sense of emotional numbness and detachment. They may feel like they're simply going through the motions without any real passion or connection to their life. So, what can be done about this? Here are some strategies to manage high-functioning anxiety and depression. Number one, and as you've noticed throughout my videos, this is always number one, is recognizing and acknowledging the struggle. The first step is acknowledging that something isn't quite right. If you feel like you're going through the motions, it's important to recognize that these feelings are valid. Acceptance is the first step towards healing. Number two is prioritizing self-compassion. For high-functioning individuals, the inner critic can be incredibly loud. Practice self-compassion by treating yourself with the same kindness and understanding that you would show a friend. This means acknowledging that it's okay to not always be on or perfect. You don't have to do everything by yourself. Number three is to set boundaries and rest. Learning to set boundaries is key if you're constantly pushing yourself to the limit. It's crucial to recognize that rest and recovery are necessary for long-term health and well-being. Setting boundaries around work, social commitments, and your personal time will help reduce the feeling of overwhelm. Number four is therapy and support systems. Therapy is an excellent way to work through anxiety and depression. Cognitive behavioral therapy, CBT, mindfulness techniques, and somatic therapies can help you uncover the root causes of your stress and develop healthier coping strategies. Additionally, consider seeking out support groups or speaking with a trusted friend or mentor. You don't have to go through this alone. Number five is breaking the cycle of perfectionism. Perfectionism often fuels anxiety and depression. Challenge the belief that you must be perfect or constantly achieving in order to be worthy. Start with small steps. Allow yourself to make mistakes, take breaks, and show yourself kindness even when things aren't going perfectly. To anyone who's watching this, if you can relate to high-functioning anxiety or depression, I want you to know that you're not alone. It's easy to assume that because you're functioning well on the outside, it means everything is fine. But the truth is that it's okay to struggle and it's okay to seek help. Healing takes time and it's okay to slow down. You don't have to have everything together all the time. In fact, embracing your humanity and vulnerability can lead to more authentic connections with others and with yourself. If this video resonated with you, be sure to like, share, and subscribe for more content. And as always, be kind to yourself, take it one step at a time, and give yourself permission to rest. Take care, and I'll see you next time.